Hello there. I hope you are doing well this evening. My name is Dr. M, and I will be performing your cranial nerve examination today. Can I confirm your name and date of birth, please? Okay, good. So, in your appointment today, I'm just going to be walking through a series of tests with you to make sure your neurons and neurological pathways are all functioning as they should be, okay? Okay. So before we get started, I have just a few questions for you. Have you ever had a cranial nerve examination before? Yes, okay. And how long ago was that? Okay. And do you have a history of concussions or any other cranial injuries or issues? Some headaches? All right. And how frequently would you say those occur? Once or twice a week? Okay. And do you take any medication for those headaches? Yes. Okay. Just Advil? All right. And that makes it go away all better? Okay, good. All right. So we can go ahead and get started. What I want you to do for me is just scoot all the way up. Make sure your knees are at the edge of your seat. Uncross your arms and legs and keep them about shoulder width apart. Okay? Perfect. So the first thing I'm going to be testing today is your sense of smell. All right? Do you have a history of allergies, asthma? Okay, and have you been ill recently? No, good. And you haven't noticed any other issues with your nose? Okay, perfect. So I have some files on my table next to me that contain different scents, and we're just going to be testing your sense of smell with that. But first, if you can take a finger and place it over your right nostril and go ahead and take a breath for me through your nose. Okay, good. No issues there. Okay, you can go ahead and switch sides for me and place your finger on your left nostril. Take another breath. Okay, very good, no issues. So we'll go ahead and get started. I'll just take one of my vials here, and I'm just going to be dabbing the smell onto this smelling paper for you. Okay? Go ahead and again cover your right nostril and tell me what you detect with your left nostril, please. Lavender. Perfect. Go ahead and switch nostrils for me. So cover your left nostril. All right. And let's test this side. What do we detect? Vanilla. Perfect. Very good. You can go ahead and uncover your nostrils for me. So, we'll test both sides now. What can you smell right here, please? Coffee? Good, perfect. And I have one more for you. And one more time, what can you smell? Apples. Perfect. Well, no issues there, it looks like. So now we'll move on to the bulk of our test. It's just going to be a series of different eye examinations. Have you noticed any issues with your eyes? Okay, do you wear glasses or contacts? Contacts. Alright, good. And have there been any changes in that prescription? Okay, good. So first, we're going to do a little vision test. I have this chart here. I'm sure you're familiar with it. If you can go ahead and cover your right eye, please. Okay. And what's the lowest line you can read on this chart? Right here? Okay. So we'll go from the right. Can you tell me what this letter is? Right here? Okay. And this letter? Right here. Okay. And this letter right here, please. Okay, very good. You can go ahead and cover your other eye. Good. And what's the lowest line you can read here? This one as well. Okay, we'll go from the left. What is this letter? Good. And this one? Good. And this one? Very good. You can uncover both eyes. And can you read this line? Okay, very good. Can you read this line right here? Okay. Okay, good. No issues there. Just put that on my table. All right, and now I will be taking a close-up look at your eyes here and just testing your pupillary reactions. So if you can go ahead and cover your right eye for me. Okay, good. Just be taking a look in your left eye here. Okay. Okay, switch eyes for me. Okay, you can uncover both eyes. Okay, everything looks good. I'll give your eyes a little break. Next, I'll just be taking a close-up look at your retinas. So whenever you're ready, go ahead and cover this eye for me, please. Okay, good. Just stare straight ahead and try not to blink. Okay. Stare straight ahead. And look up for me, please. Okay, and look down for me, please. to your right, and to your left. Okay, good. Cover that up for me, that eye up for me. Okay. So stare straight ahead with your other eye. Good. Straight ahead for me. Okay. And look up for me. Okay, and look down for me, please. Okay, and to your right. And to your left. Okay. Very good. Everything looks nice and healthy back there. So, now we are just going to continue with a few more vision tests. Okay? So the first thing I'm going to have you do is cover up this eye for me. Good. And just let me know when you can see my fingers wiggling, okay? Okay. 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 Good. Good. Very good. You can switch eyes for me. Okay. And again, let me know when you can see my fingers wiggling, okay? Okay. 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 Okay, very good. Uncover both eyes for me and point to the side that the fingers are wiggling, or just let me know which side has the wiggling fingers, okay? Okay, ready? Okay. 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 Okay, very good. Now you can stare at the tip of my finger. Alright, and I'll go from the tip of my finger to the wall behind me and back, okay? Very good. Now continue to stare at my fingertip and just follow my finger, please. Checking for double vision, tension, any double vision anywhere. Okay, good. Very good. All right. Now, I have this pin here. Can you cover this eye for me? Okay, what color is this pen? Blue. Very good. Cover your other eye for me. And what color is this? Blue. Good, yes. Now, uncover that eye. Color is this? Blue, yes. Are they all the same color blue? Okay, no differences? Okay, perfect. Now if you'll just look at the tip of this pen and tell me when this leaves your vision, okay? And then tell me when it comes back. So just stare straight at my nose. Let me know when it leaves. Okay, and when it's back. Okay, good. Okay. 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 Very good. So I don't see any issues with that either. Everything is looking very good so far. Right. So next I'll just be testing a few facial sensations with my gloves on. So first, I want you to stare straight ahead and try not to blink. I'm just going to tap your forehead and temples, okay? Just try not to blink. Okay. Okay. Very good. Now, I have this feather right here. It has a sort of pointed but dull end, and of course it has the very soft end. Okay, feel the dull end for me with your fingers. Good, and feel the soft end. Okay, good. Now stare straight ahead with your eyes open and just don't mind me. Continue to stare straight ahead for me, please. Okay, good. Go ahead and close your eyes and let me know when you feel this. Okay? Close your eyes. Okay. 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 Very good. I also have this cotton swab. It's very soft, of course. Go ahead and feel it with your fingers. Good, soft, right? So go ahead and close your eyes again and let me know when you feel the cotton swab. Okay. 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 Okay, very good. Now keep your eyes closed for me, please. And tell me if what you feel is rough or soft, okay? Rough, yes. Soft, yes, correct. Rough, yes. Rough. Rough. Soft. Soft. Rough. Very good. Alright, you can open your eyes now. Go ahead and raise your eyebrows like you're surprised. Very good. And scrunch your face together like you're mad. Okay, good. Blow out your cheeks like you're a pufferfish. Okay, good. Go ahead and close your eyes and try and keep them closed like you have soap in them, okay? I'm going to try and open your eyelids, right? But don't let me. Okay, and... Okay, very good. Now if you can show your teeth and clench your jaw for me, please. Just feeling for any asymmetry. All right. If you can close your mouth for me. Now I'm just going to lightly tap just below your chin, okay? Okay, very good. Right, almost done here. So, now if you can look all the way to your left for me, turn your head all the way left. Good, and hold it. Okay, good. Now turn your head all the way to your right for me, please. Hold it. Okay, good. Any pain or tension in your neck or the back of your head while doing those exercises? No, okay, good. Now if you can look up all the way to the ceiling. Okay, good. And look down, please, to the ground. Okay, good. Any tension there at all? Good. Perfect. Shrug your shoulders for me. Okay, keep them shrugged. I'm going to try to push them down, but don't let me, okay? So push. Okay, good. Now if you can extend your arms for me, like you're a zombie, keep them parallel to the ground, and your palms up, okay? And just keep them steady. Okay, good. Now close your eyes and just keep them straight and steady for me, please. Steady as you can. Okay, very good. You can open your eyes. Now I'm going to try and push your arms down, but don't let me, okay? So push up. Okay, good. Now I'm going to try and push them up, but don't let me, okay? Push down. Okay, good. Now rotate your arms inward for me. Thank you. I'm going to try and push your arms out, but push against me, okay? So push. Good. I'm going to push them in. Don't let me, okay? Push out. Very good. Very good. So, our last part of your examination today, we are just going to do a quick hearing test, okay? So, first thing is I would like you to close your eyes, and I'm just going to make a soft noise in your ear. Just let me know which side, okay? Okay, good. Close your eyes. Which side is this? Okay, good. This. Okay. This. Good, and okay, good. You can go ahead and open your eyes now. Perfect. So the next test is I'm just going to whisper a word in your ear, and then I want you to repeat that word back to me, okay? Okay, so lamp. Lamp, good. Okay. 33. Yes. Okay. Bear. Very good. Bear. And last one. Okay. Vacuum. Vacuum. Very good. So, our last portion of your test, I'm just going to repeat what I just did, except I'm going to be making a soft noise in your opposite ear. So just repeat back to me. the word that you hear, okay? Okay. So, laptop. Laptop. Very good. And wait. Wait. Very good. And book. Book. Very, very good. So, that concludes your examination with me today. Thank you for coming in and taking care of your neurological health with us today. We'll just give you a call whenever our calendar opens up for your next exam. All right? Thank you. Hey, it's good to see you again. I hope you're doing okay. So what's been going on? Okay. All right, you think you looked a little bit too long at the eclipse a couple of days ago. Okay. No, that's not a problem. Super common. We get more questions than you would believe. So no worries. But let's go ahead and talk about it a little bit more. How long did you look at the eclipse? Okay. And was this with or without the eclipse glasses? Okay. It was with sunglasses. Yeah, those actually are not approved eclipse eyewear, believe it or not. So, yeah, we'll get to the bottom of it today. No worries, okay? So that whole period you were looking at the eclipse, that was with sunglasses. All right. Okay, and since then, have you noticed any problems in particular that have to do with your vision? Okay. Yeah, and I'll ask you a few questions here in a second. When was your last eye appointment with us? Okay, great. Not too long ago. Perfect. Yeah, we just want to make sure that we if we need to take any pictures or anything like that, we know what your eye looked like the last time you were here and when we were 100% sure that you didn't burn your retina, So, just wanted to ask. All right. So, have you had any issues since the eclipse? Seeing certain colors? Okay. Does your vision seem a little bit dim or dark even when you are in a fully lit place? Okay. Any weird waves when you look at something that you know is straight, like a tree or a pole? Does it seem curvy at all? Okay. Have you had any double vision? Alright, any weird floaters such as webs, rings, or squiggly lines? Okay. And is this sort of common for you? Is this an all the time thing, or have you really just noticed it since the eclipse? Or has it gotten worse? Okay. Any unexplained flashing lights? Okay. Halos around light sources? All right, how about any issues focusing or with double vision? Right, any weird shadows, blind spots? Okay, particularly in the center of your vision. All right. A decrease in vision quality overall. Okay, got it. And last question for you here. Any pain either in your eyes when viewing bright lights or any headaches? Okay, and where would you say that you feel this pain the most? Sort of right here. Okay. All right, gotcha. Well, thankfully, in this day and age, we have a whole lot of tests that we can do to assess the damage, if there is any, and then we'll come up with a plan for what we can do, okay, if we do detect that you might have done something to your vision, okay? Okay. All right, so first we're going to go ahead and start by assessing your color vision, okay? This is usually what gets affected the most if you do look at the eclipse for a long time, okay? All right, so real simple. I have this booklet here. You can see there are some hidden numbers, and I just want you to tell me the numbers that you can see within these circles, okay? Looking right here. Okay, and this number. Very good. Next page here. How about this number? All right, and this number. Okay, very good again. Okay, last page. Okay, number over here. And number over here. Okay, very good. All right, now I have a few pictures I want you to look at. Okay. I have these two pictures of a cute little beach scene. I want you to tell me which one is more saturated. Okay, very good. How about now? Which one is more saturated? Okay. And now, which one is less saturated? Okay. And between all three, which one looks in the middle? So the most normal, I suppose. All right. Very good. Let's put those away. Next, we have this line of circles, and I just want you to point to all of the completely yellow circles. Okay, very good. This is yellow. Okay, are there any more? Okay, I see. Very good. And next, I have this really nice color chart. Let's see. And I want you to point towards a really bright true red. Okay, very good. And I want you to tell me, what color is this? How would you describe this color? Okay, and how about this color right here? And how about this color up here? Okay, very good. And I'm going to put this shade over your vision. Ready? 1, 2, 3. Very easy. Now I want you to point to a true blue. The bluest blue that you can find on here. Okay, and how about a very true orange? Crayola, 8-pack of crayons, orange. Okay, very good. And now, I want you to tell me what color are these colors. There's a lot of different shades, so what color is this? Okay. And right here, what color are these? They're all shades of, yes, very good. Very good. And these are all shades of, perfect. And one more time with the shade. Okay. And what color? Okay, good. And what color? Good. And what color? Okay, very good. Good. So those are all, or most of the color tests. Really easy, just like I said, right? Okay. Just write a few notes here. Alright, and now we're going to move on to sort of assessing your regular vision. So I have the very classic eye chart here. Can you go ahead and tell me what this letter is? Good. And this letter? Alright. Can you read this line for me? Right there. Very good. Okay. How about this line down here? Okay. Very good. I'm going to pop that shade over your eyes once again. Okay. Ready? 1, 2, 3. Very good. Can you read the third line from the top? Very good. And the line below that. And the very bottom line. Can you read that for me? Okay, how about the line right above the bottom line? Okay, very good. Good, good, good. All right. And now we're going to do something a little bit fun. I'm going to adjust the lights in the room. And after I dim them, I want you to tell me, so I'm going to dim them and they're going to be dark. And then I'm going to bring the lights back on and I want you to tell me how long it takes for your eyes to adjust to the light, okay? Alright, so we're turning off the lights. for most of the lights. Okay. And we're going to turn the lights back on. Okay. So how long did it take your eyes to adjust to the light? Okay. Did you experience any pain or anything? Okay, good. Now I'm going to turn just one of these lights off. There it goes. And I'm going to change the color of the other light in the room. And I want you to let me know when the light in the room is red. Okay, so you can just raise your hand or let me know when that is red. Okay, good. All right, and go ahead and raise your hand when the light is blue. Okay. Right, and raise your hand when the light is green. Okay. Okay, very good. And raise your hand when the lighting is pretty much back to where it was, okay? Right about there. Okay. Yep, that's just about where we were. All right, I'm going to pop that other light back on and let me know if you have any pain and about how long it takes for your eyes to adjust, okay? Okay. Very good. All right, so we're gonna play that game again. I'm once again gonna turn this light off. So we're just working with one light. And I'm going to dim the one light we have left. And I want you to tell me when this T right here, when you can't see that letter anymore, okay? Alright, so just look at that T for me. Okay. Very good. Alright, and while you're in a very low light environment, I want you to have a look at these pictures here. I'm going to dim the brightness on my device so you can't cheat. Okay, I want you to go ahead and point to the pig. Okay, go ahead and point to the pumpkin. Okay, and lastly, can you point to the acorn? All right. Very good. All right, let me get those lights back on. We're still not feeling any pain or anything like that? Okay, great. Great. Right. Okay, so next we're going to do a lot of things that I'm sure you've seen before. I want you to go ahead and follow the very tip of my pen for me. Just like that. Perfect. See, you've clearly done this before. Very good. And any double vision, any pain. Okay, great. Now I want you to look at my nose. Keep looking at my nose and tell me when you see the fingers wiggle. Good. Good. Keep looking at my nose. Very good. And very good. Perfect. Okay. Now we're gonna get the light out. Right, bright light. Again, let me know if you experience any pain or tenderness or anything like that. Okay? Alright. So first I want you to follow this light. Okay, are you seeing any unusual halos? Bright flashes? Okay, very good. Keep following. Great. Now I'm gonna get up close and I want you to look at my nose, okay? Great. Just gonna make sure these reflexes are still there. Okay. Okay, good. Very, very good. Alright, no halos, floaters. Okay. Just making sure. And now we're going to make sure your depth perception is okay. Alright? Alright. So to start, I have these two little needles in my fingers, okay? See them? One's got a blue tip, one's got a pink tip. Okay, I want you to tell me which one is closer to you, okay? Ready? Good. 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 Alright, perfect. And now I want you to tell me approximately how far apart these two are from each other, okay? So if you were to measure the distance between the pink pin and the blue pin right now, about what would that be in inches, okay? Or whatever measurement you want to use. Alright, ready? Okay. Okay. Right? Okay. Okay, good. Let's put those back in a little cushion so nobody gets stabbed. We are not that kind of doctor's office. Alright, and lastly, we're going to break out these depth perception plates. Okay, so in one of these four squares, there you can see a circle, and I want you to tell me which square you can see the circle in, okay? Alright, good. How about now? Good. And now? Very good. That was the easiest one. So, we've got two more for you. How about on this plate? Right. How about now? Okay. Now? Good. And the last plate. All right. Okay. And lastly. Okay. Right, well, that concludes all the tests that I have for you today. And good news, I'm not seeing anything that would indicate significant damage or any burns to your retina, which is great to hear. I am just seeing a little bit of evidence that your eyes are a little tired and strained at the moment. Okay, so what we can do for you, if you want, we can give you eye drops, a prescription, or even an over-the-counter recommendation if this is something that happens a lot. And also, as all doctors recommend, I recommend that you stay away from those screens. Make sure you're using appropriate eye protection when you go outside. Okay, and even on days where an eclipse is not taking place, be careful of that sun and don't look directly into it. Alright, very good. Well, the nurses will get you all checked out. It was great to see you today. And for the next eclipse, make sure you have the approved eyewear. Okay, I wouldn't want you to miss a thing. Alright, it was great to see you. Thanks for coming in, and I'm glad we could help. And I hope you have a great rest of your day. Bye. Hi there. Welcome back to the ear clinic. It's great to see you again. Yes. I'm assuming everything has been going okay. Okay, that's great to hear. But we just have to ask you a couple of questions before we get started, okay? Okay. Can I have you spell your last name for me again? Okay. Always like to make sure. And can I have your birth date one more time? Okay. Great. And I just want to confirm that your address, phone number, email, none of that has changed since your last appointment. Okay, great. Oh, and your insurance, is that up to date as well? Okay, as far as you know. Okay. Right? So, again, a couple of questions. Are you currently experiencing any issues with your ears? Right? Are you currently experiencing any issues with your nose or throat? Okay. All right. Have you had any issues with your ears, nose, throat in the last 6 months? Right? And how long has it been since your last hearing test? Okay. All right. And how long has it been since you've had your ears professionally cleaned? Okay. And do you clean the inside of your ears at home on a regular basis? Okay. Do you clean the outside of your ears at home on a regular basis? Okay. How often do you go swimming? Okay. Okay. And do you use any sort of ear drops or other types of medication either in or on your ears? Okay. Okay. All right. Have you ever had an ear infection in the middle or outer portions of your ear? Have you ever had any issues with foreign bodies being stuck in your ears? Right. Do you or anyone in your family have a history of any of the following? Is the next page. Okay. Tinnitus, vertigo, deafness, acoustic neuroma, frequent earaches, excess fluid buildup inside the ear, labyrinthitis, and Meniere's disease. Okay. All right. That's all of our questions. So now we can get started. As you know, we like to clean all of our patients' ears while they're in the office with us. So we will be doing that today. And because we are cleaning them, we will do a hearing test before and after your cleaning. All right. Since, according to your records, the last time you visited us, we did a full hearing test with the beeps and the different octaves. This time it will be a more quick, shortened version of the test. Okay. All right, but we have had some fun updates to our cleaning supplies, so that will be a little bit different. Okay, everything sound okay? Any questions so far? Great. Well, I'll go ahead and get started. So we'll start today with a basic examination of your outer and inner ear, and then we will move on to that hearing test and cleaning. And hearing test again. Okay. Putting the gloves on here. Okay, so first I'm going to gently press on your sinuses because of course they are connected to your ears. Okay. Is it okay if I touch? Perfect. So, gently pressing on your front sinuses, just below your eyes, okay? Any tenderness or pressure? Okay, good. How about up here? Any tenderness or pressure? Okay. Good. All right. And now I will move on to your outer ear. And I'm going to bring some tools with me to check for dirt, okay? So if you can just remain still, facing forward, look forward, okay? And I'll be on either side checking out your ears. Okay. All right. So, we start with a general examination of your ear, making sure the cartilage is nice and strong and there are no weird bumps or lesions anywhere. Okay. And I'm going to check for dirt along your ear. Okay, and right behind your ear, okay? Check for dirt back there. Okay, just a little dirt, but nothing out of the ordinary. Okay, we're doing good. Okay. Just going to come over here to your other ear and look around. Okay. I'm not feeling any bumps or lesions or anything worrisome. Is there any tenderness when I press right here? Okay, how about up here? Okay, perfect. Everything seems to be in perfect condition. Let me just test for dirt. Okay, nothing right there. And now I'm just going to swipe right behind your ear again. Okay, in that little groove where your hair gets tucked in. Okay. Alright, looks like you have just a normal amount of dirt. Okay. Alright. Everything looking good so far? You're okay? Okay, great. Now I'm just going to inspect your inner ear with my little tool, okay? So let me know at all if you are ever uncomfortable, alright? Or if you feel any pain or tenderness. Okay, it's very important. Alright. So, moving on to this side, just going to nestle that in to your ear and look for any damage or fluid that might be in your ear on this side. on your other side. Alright, just remain looking straight ahead for me. Just going to put my tool into your ear. Okay. Once again, checking for any signs of a fluid or wax buildup, any redness. Okay. Now I'm doing a small wax test. Okay. Again, a little bit of wax, but nothing too major. Okay. Alright. You write a few quick notes here. So everything is looking great so far, but I am seeing a little bit of wax built up in both of your ears. So I'll pay careful attention to that while I am doing your cleaning. But other than that, I'm not seeing any redness or lumps, bumps, fluid out of the ordinary. Okay? Alright, so I don't think you have anything to worry about. Okay. So now we'll do our quick hearing test before I do your cleaning. Okay? So I need you to close your eyes for me, okay? Just close your eyes. Okay. So first, I need you to repeat these words back to me. Okay? Alright. Truck. Yes, very good. Okay. Hat. Good. Album. Good. Very good. Okay, one more. Alright. Laptop. Good. Very good. Alright. So, with your eyes closed, now I need you to raise your hand whenever you hear the sound of my glove. Okay? Right? Ready? Okay. Good. 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 Okay? And keep those eyes closed. Now I need you to raise your hand on whichever side you hear my glove, okay? Okay, ready? Good. Perfect. Good. Good. Alright, perfect. And now I need you to tell me which side the glove, once again, sounds loudest on, or tell me if it sounds like it's coming from in the middle. Okay. 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 Perfect. Very good. Easy. Okay, so now we can go ahead and move on to your cleaning. The first thing I'm going to do is put a drape over the side of the ear I'll be working on, okay? Just to protect your clothes from anything. Alright. Just put that around you. Okay, very good. So, of course, I'll be working on this ear first. Right. And first, I'm just going to dust away some dirt from the outside of your ear, okay? So again, let me know if you ever feel pain, tenderness, or just generally uncomfortable, okay? Okay, very good. Okay, so that's the easiest step. Now I'm going to take a special scraping tool and scrape out all these harder bits of wax and dirt in your ears. a lot of big pieces out with that. So the next part is one of our new appliances. We have a water pick that I will insert in your ear. And this water pick has a special cap on it that will pump water through the water pick into the cap and spray water inside of your ear at an angle, of course, so it's not going directly in your ear, but this warm water will help dislodge some of that deeper wax, okay? And then it will just run out of your ear. Okay. Alright. So again, this will only last a few seconds. Let me know if at any point you feel uncomfortable, okay? Alright. Just going to place it in your ear. Okay. And I'm going to begin. Okay. Let's see what we've gotten out the ear. Okay. Gotten a really nice big clump out. And now what I'm going to do is just dry that ear off, okay? Then plain old paper towel. Okay. And next, let me take a quick look again with my little light contraption and make sure everything looks okay. Okay, just looking in your ear. Okay, let's see. Looks like I've got most of the wax out of the ear. Just needs to be cleaned up a little bit, especially the outside of the ear. Then they'll be good to go. Alright, that looks good. Next, we have some ear drops. I'll just put in your ears, okay? You can tilt your head to the side a little bit. Okay. Perfect. Right. Got some on my fingers. Okay. And then I'm going to just spray the outside of your ear with some water, okay? To get rid of any of the wax that might have crusted on the outside, okay? Just cover. Okay. And then a quick wipe. With an antibacterial wipe to get the last of that wax. Okay. And then we'll finish with a moisturizing lotion. Okay. There we go. I'll leave that open for your other ear. All right. Just gentle lotion. Around your ear to make sure that the skin stays healthy and moisturized. Okay. Wipe the excess. Good. And we are all done with that ear. Right. So then I'll just repeat this process on your other side. Okay. So let me wipe away the dirt and the dust. Oh, I need to move the drape over. Let me just re-drape. Okay. Now, I'll dust. Okay, now the inside of your ear. Just a gentle brush. No. Okay, very good. And now some scraping on the inside. Let me know if you're uncomfortable. Going to insert the water pick. Okay. Let's see. Okay, I'm going to start the water pressure now. in with my paper towel. Okay. Right. Do my quick look. Almost done. Just taking a quick look into the ear, making sure I've got most of the wax out. And it looks like that I have everything looks good. Okay. Right. Now our ear drops. Okay. Right. Quick spray to the outside. Okay. And I will do gentle wiping. And our moisturizing lotion. Okay, just a teeny tiny bit. Okay. Perfect. All done. Okay. Okay. Right. Let me remove the drape. Let's see, where's the clip? There we go. All right. And our hearing test to finish up. Okay? Close your eyes. Repeat the word back to me. Ready? Lamp. Good. Telephone. Good. Egypt. Good. Very good. You've got it. Keep your eyes closed. Which side is the noise loudest on? Okay, raise your hand. Good. 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 Middle. Okay, good. And raise your hand when you hear the noise. Good. 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 And looks like we're all done. So, according to everything that I saw during your examination today, as well as your family history, it looks like you are perfectly fine and your ears should be squeaky clean. Right. Go ahead and sign off on your paperwork. And I'll see you in a few months. Thank you so much for coming and getting your ears checked out by us once again. I hope everything goes well for you until it's time for your next ear cleaning. Thanks. I'll see you very soon. Welcome to your cognitive screening assessment. Today we will be testing for any cognitive dysfunction you may be experiencing. The test will assess several cognitive domains, such as attention and concentration, executive functions, memory, language, and so on. I will only repeat instructions once, so please make sure you are paying attention. Before we begin, I'm going to hand you a pen and a piece of scratch paper that I'll have you use several times throughout the test. Are you ready? Okay. Here is your pen. And here is your scratch paper. All right. We are going to start with some orientation questions. Please answer the following to the best of your ability. Can I have your name? Can I have your date of birth? What is your highest level of completed education? What is your ethnicity? Have you had any problems with your memory or thinking? Have you had any blood relatives that have had problems with their memory or their thinking? Do you have balance problems? Have you had a change in personality? Can I have today's date, the month, the day, and the year? What day of the week is it currently? What city are we currently in? What country are we currently in? Who is the current U.S. president? What season is it currently? Can you tell me something that has happened recently on the news? Can you tell me something that you personally did yesterday? And can you tell me what we are doing right now? Good. Next, I want you to take a look at this piece of paper for me. We have several circles with numbers and letters in them. I want you to draw a line going from one circle to another, alternating numbers and letters going in descending order. For example, you'll go from 1 to A to 2 to B and so on. You will begin at 1 and end at F. You can use your pen to complete this exercise. Have you completed the exercise? Okay, let's take a look. Okay, excellent. Next, we will be testing your recognition. I would like you to have a look at the animals on this piece of paper. What is this animal right here? Good. And can you tell me where you would find this animal? Good. Next, can you have a look at this animal right here? What is that? Good. Can you tell me where you would find that animal? Good. And lastly, this animal right here. What is that? Good. And where would you find that animal? Excellent. Now, I would like you to take a look at these 3 objects or tools. Can you tell me what this object is? And what is that typically used for? Good. And the middle object right here, what is that? Okay. And what is it typically used for? Good. And the last object right here, what is that? And what is that object typically used for? Excellent. Now I'm going to ask that you pull out your scratch paper. Okay. I would like you to draw me a clock on your scratch paper with all the numbers in place, and I would like the hands on that clock to be showing 10:30. You can take your time with this picture and let me know when you are finished. Okay, have you completed it? Okay. Okay, excellent. Now, I have this image right here of a cube. I would like you to copy this image as best you can on your scratch paper for me. You can take your time once again and let me know when you have completed it. Okay, let me have a look. Okay, very good. All right, now we will be doing a few memory exercises. I am going to read a list of words that you will have to remember now and later on. When I am finished listing the words, I would like you to tell me all the words that you remember. The order that you repeat them in does not matter, so you can tell me them in any order you would like. Face, velvet, church, daisy, red. Can you repeat them back to me? Excellent. Now I am going to repeat those same words again, and just like before, you will repeat them after me in any order. Face, velvet, church, daisy, red. Good. In a few minutes, I am going to ask you to once again repeat those words back to me. Next, we will be doing some attention exercises. First, I'm going to list a sequence of numbers. When I finish, I am going to have you repeat those numbers back to me in the same order as I said them. Ready? 2, 1, 8, 5, 4. Okay. Now, I am going to list another sequence of numbers, and I will have you repeat them after me. But when I do, I would like you to repeat them in the opposite order. So for example, if I say 1, 2, 3, I would like you to repeat 3, 2, 1. Okay. 7, 4, 2. Very good. Next, I'm going to list a series of letters. When you hear the letter A, I would like you to simply tap your hand. If I do not say the letter A, do not tap your hand. Ready? F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Good. All right. Now, I will ask you to count by subtracting 7 from 100, then 7 more from that answer, and so on until I ask you to stop. Take your time. Begin whenever you are ready. Okay, good. Next, can you tell me how many quarters would be in $8.75? Good. And if I paid for an item at a store with a $5 bill, and that item was $1.92, how much change would I receive? Good. Okay. Now we are going to be repeating some sentences. I will read you a sentence, and I want you to repeat it after I do. Sentence 1. Judy met an interesting turtle while the song on the radio blasted away. Good. Right. And sentence number 2. Various sea birds are elegant, but nothing is as elegant as a gliding pelican. All right. Next, I am going to ask you to take out your scratch paper once again, and I'm going to have you create a sentence. It can be about anything you want it to, but it must have proper grammar and include a subject and a predicate. You may begin when you're ready. Okay. Let me look. Okay. Good. All right. Now, I want you to tell me as many words as you can think of that begin with the letter R. I will tell you to stop after 60 seconds. Numbers and different forms of verbs do not count. Are you ready? Okay, you may begin. Okay, you can stop. Very good. Now, I would like you to list 15 different fruits and vegetables. You may start when you're ready. There is no time limit for this exercise. Okay, very good. All right, next we are going to test your abstraction skills. I am going to list a pair of words, and I would like you to tell me what these words have in common with one another. And then I would like you to tell me how these words are different. Okay. Number 1, watch and ruler. And how are they different? Okay. Set number 2, train and bicycle. And different. Okay. Set number 3, hammer and screw. Different. Okay. And lastly, I am going to ask that you recall the 5 words I had you repeat in the previous exercise. Good. This concludes your cognitive assessment. Thank you for coming in, and your provider will be in contact with you soon to discuss your results. If you would please put all of your scratch paper and other test materials I've given you right under this stack of paper. Thank you. Once again, thank you for coming in and testing with us, and we will see you again soon. Goodbye. Hi there. My name is Em. Nice to meet you. I'm going to be the nurse practitioner taking care of your case today. Is that all right? Okay, great. Never had anybody say no, so. Alrighty. Well, what's going on? Okay, having some issues with sleep. Okay, do you want to go ahead and tell me about that? Okay, so just some general issues. We're not quite sure what might be happening. Yeah. About how long would you say this has been going on? Wow, okay. So, kind of a long time to be operating with less than ideal sleep, wouldn't you say? Yeah. Well, I am so glad that you got in to see us today. Sleep is so important, and it is so overlooked by most people and even most doctors sometimes. Yeah. We want you at your best, awake, refreshed, and ready to tackle your day. So hopefully we can get this taken care of for you. Right? Well, based on some of the things that you've told me today already, I think we're gonna do a couple of things during our appointment today to sort of dive deeper into your sleep habits and a couple of other things. And at the end of the appointment, I think I'm gonna try and get you in for either a take-home or an in-office sleep study. Okay? Does all that sound okay? All right. So we're gonna go ahead and start off with this questionnaire. It's a little long. I apologize. But it goes really in depth. And it's sort of going to check for a couple of things that might be having an impact on your sleep, and sort of gauge the probability of maybe some sleep apnea taking place. Have you ever heard of sleep apnea? Okay, well, it's basically just when your breathing stops and starts while you sleep. So a lot of people, while they're sleeping, they stop breathing for a few seconds, and then they wake up, they're gasping, and they start to breathe again, and then they fall back asleep. And for some people, this happens several times a night, and they don't even realize it, and it really impacts sleep quality. So that's sort of the main thing that we're checking for. But of course, there can be other things going on as well. Acid reflux, a lot of things impact our sleep, right? So this questionnaire is going to go through all of that, and hopefully it'll sort of point us in the direction we need to be looking. Yeah, all right. So we'll go ahead and get started. I'm going to go through this with you, okay? And again, it is a little long, so I apologize. But hopefully we'll be able to sort of zoom through it here. All right, can I get your name one more time? Okay, and how do you spell that last name? Right, great. Can I get your age? Okay, do you know your height? Yeah, okay. All right, and your current weight? Yes, it's fine, it's fine. I'll check with the chart online. Okay, we're gonna start off with past sleeping problems. So have you had a sleeping problem diagnosed by a doctor in the past? And if yes, what was the problem? And the treatment? Okay. Okay. All right, and that's all the past sleep problems, short section. All right, now we're going to go into your sleep schedule and hygiene. Do you keep a fairly regular sleep schedule? Yes, no? Okay, and how much would you say your bedtime varies over the course of a week? All right, not too bad. Okay, what time do you usually go to bed on weekdays or days that you work? Okay. What time do you usually get up on weekdays or days that you work? Okay. What time do you usually go to bed on weekends or days that you do not work? All right. And what time do you usually get up on weekends or days that you do not work? Okay, and do you usually feel well rested upon awakening? Okay, how would you describe how you feel? Okay. How many hours do you usually sleep on the days that you work? Okay, how about on the days that you don't work? Okay, do you nap during the day? Okay, number of naps per week. Okay, average length. Okay, and if and when you do nap, do you feel refreshed afterwards? Yes, no, somewhere in the middle. Okay. Do you read in bed? All right, a few yes or no's here. Do you watch TV in bed? Do you frequently look at your bedroom clock at night? Okay, do you have arguments in bed? Do you eat in bed? Do you worry in bed? Do you currently do shift work? So you're working overnight. Okay. Have you done shift work in the past? Okay. All right, if you have a spouse, do they perform shift work? Okay. On to the next page here. See, it's going pretty fast, right? Okay, sleep environment. Okay. Do you share your bed with a spouse? All right. How about a pet? How about any children? Okay. Right. Please, let's see here. All right. Do you find that your sleeping environment is too hot? Too cold, maybe? All right. Is there too much light in your sleep environment? Okay, how about too much noise? Okay, do you experience frequent interruptions while you're sleeping? Okay. All right, is your bed in any way uncomfortable? Okay, what is the age of your mattress? All right, would you say it's in pretty good condition? All right, it's not like pre-owned or anything. Okay. Okay. Let's see here. Okay, do you often have trouble getting to sleep at night? Okay, are you sleepy when you go to bed, or are you kind of awake? Okay. And what is the average number of minutes it takes you to usually fall asleep at night? Okay, and do you have any issues? Do you find you can't stop thinking whenever you are trying to fall asleep? Okay, do you watch the clock? Okay, are you frustrated over your inability to sleep? All right, do you think, or do you usually sleep better in different environments, such as when you're on maybe vacation? Okay, all right. Do you think your sleep would be better if you could go to bed later, like 2 or 3 a.m., and wake up later, as opposed to your current schedule? Okay, or even later, I suppose. Basically, do you find that you're a night owl and you tend to stay up? Okay. Do you often have awakenings during the night? And if so, what is the average number of times that you wake up? Yeah, for anything. Okay. All right. Let's see. Do you have any pain anywhere while you're asleep or trying to get to sleep? Okay. Heartburn. All right. Worry. Any children? Leg kicking or movements? Snoring. Choking, gasping, coughing. Night sweats, hot flashes. Do you often need to use the restroom during the night? Okay. Any breathing difficulties? Okay, any loud noises waking you up? Maybe. Okay. Any bed partners kicking you, knocking you off the bed? Hopefully not. Any belly cramping? Okay, anything else bothering you? Right. Okay. On most nights, do you find that you have periods where in the middle of the night you wake up and you have a lot of trouble getting back to sleep? Okay. Are you bothered by waking up too early? You wake up, before your alarm, and you find that you can't get back to sleep, maybe, and you just have to get up. Okay. Alright. Let's see, this section is called movement. Do you wake yourself up by kicking your legs or making any other movements during the night? Okay. Have you or a bed partner ever complained about you yourself kicking or moving during the night? Okay. Do you have a vague sense of discomfort or an unpleasant sensation in your legs, which is only relieved by getting up, rubbing your legs, or moving around? Okay. Right. Next page. All right. When you were a child, did you have any sleep problems? Okay. Do you currently have frequent nightmares or night terrors? And if so, how often? Okay. Do you grind or clench your teeth at night? Do you have morning jaw pain, or has your dentist made you a mouthpiece for anything like this? Okay. Did you frequently wet the bed as a child? And have you ever wet the bed as an adult? All right. Have you ever been told that you get up and walk around during the night? Okay. All right. Have you ever been told that you make unusually complex movements? Okay. Do you sleep talk? Okay. Right. Do you feel sleepier than the average person during the daytime? I know that's sort of hard to quantify. Maybe if you could usually tell people to compare themselves to people around them, co-workers, family members, if you feel more awake or, more low-key tired than they are. Okay, right. And how often? Okay. And do you feel that your sleepiness is a result of poor quality of nighttime sleep? How likely are you to doze off or fall asleep in the following situations in contrast to just feeling tired. So actually physically fall asleep, and this is referring to the most recent period of time, so the last couple of months. And even if you have not done some of these things recently, try and work out how, if you were in that situation, how you might react, okay? Okay, so we have a scale here. 0 is you would never doze off, and 3 is you have a high chance of dozing. So 1 is going to be slight, 2 is moderate, 0 to 3, right? Okay, so sitting and reading. Okay, how about watching TV? How about when you're just sitting in a public place? Okay, as a passenger in a car for an hour or more without a break. All right, lying down in the afternoon to rest when circumstances permit. Sitting and talking to someone. Sitting quietly after a lunch without alcohol. Okay, in a car while stopped for a few minutes in traffic. Okay. Have you ever felt sudden muscle weakness when you laughed, got angry, or when you told a joke? Right? Have you ever been unable to move your body just as you were falling asleep or waking up? Have you ever had hallucinations just as you were falling asleep or waking up? Have you ever had a driving accident or a near-miss accident as a result of falling asleep or feeling sleepy at the wheel? Okay. Alright, so now we're going to ask some questions about your respiration. Have people who have shared or are sharing your bedroom told you that you snore? Okay. Alright. Have you been told by other people that you gasp, choke, or snort while you are sleeping? Okay. Have you been told that you stop breathing during sleep? Alright. Do you wake up with morning headaches? And if so, how often? Okay. Alright. See, it's very in detail, isn't it? Do you awaken with a dry mouth or a sore throat? Okay. Do you wake with a choking or gasping sensation, or awaken yourself with any kind of snoring? Right? Do you have drenching night sweats? Okay. Does your sleep position affect your snoring? Alright, do you have difficulty breathing through your nose at all? Alright. Have you ever had surgery on your upper airway, including getting your tonsils removed or any sinus operations? Okay. Have you ever had weight loss surgery? Okay. If you are on treatment for sleep apnea, are you on treatment for sleep apnea? Okay. Okay, medications and drugs. So I didn't see your medication list on your chart, or maybe you're not taking any medications. I didn't see anything. Do you have any updates or any medications I can go ahead and write down here? Okay, so just name and then dose. Okay. Okay, and reason. Okay, that's fine. Yeah. Alright. here we go. Medical and surgical history. All right, so do you have, or have you ever had high blood pressure? Okay, acid reflux, any head injuries, stroke, heart attack, diabetes? Have you ever had a seizure, any thyroid gland problems, anemia, any kidney problems? Okay. Psychological history. Do you now or have you ever felt depressed? Do you have a history of any psychological issues? All right. Any significant personality changes? Okay. Are you currently seeing a psychiatrist or any other type of counselor? Okay. All right. And do you feel like this affects your energy levels at all? All right. All right. Do you consider yourself to be under a great deal of stress on most days? All right. Okay, so we have social habits. I think we're getting close to the end here. We have just a few more pages. All right, social habits. Have you ever smoked cigarettes? Do you currently smoke? All right. Yes or no. Have you ever smoked cigars, chewed tobacco, smoked pipe? Okay. Right. All right, now we're going to get into the caffeine. All right. So, do you drink caffeinated coffee? And if so, how many cups per day? Okay, how about decaffeinated coffee? Okay, any caffeinated soft drinks? Okay, do you currently smoke marijuana or take any other mood-altering drugs? Okay, do you currently drink alcohol? And if so, how much, right? Okay, have you ever felt annoyed by others? All right, we know that. Okay. Have you ever felt the need to cut down on your alcohol? Okay. What is your current occupation? All right, and does that involve a significant amount of driving? Do you work with any dangerous machinery? What time do you start work on average? All right. And what time do you end your work day? Okay. And do these hours vary from day to day? All right. Gotcha. All right. We're on to your family history. Do members of your immediate family snore? And if yes, who? Okay. Have any members of your immediate family been diagnosed with sleep apnea? All right. Do any members of your family have excessive daytime sleepiness? All right. Do other members of your immediate family have any other problems with sleep? Okay. And do you have any other comments about your sleep issues? I believe we have one more little form here. All right. Yeah, so We're almost done. Thanks for bearing with me, but this gives us a lot of important information about your patterns. We're almost done. So I'm going to ask you a series of questions, 10 questions, and I want you to answer with a 1 for yes, extreme, 2 for yes, moderate, 3 for yes, a little, or 4, no. Okay? All right, question 1. Do you have difficulty concentrating on the things you do because you are sleepy or tired? All right. 2. Do you generally have difficulty remembering things because you are sleepy or tired? Right. 3. Do you have difficulty finishing a meal because you've become sleepy or tired? Okay. Do you have difficulty working on a hobby because you are sleepy or tired? Okay. 5. Do you have difficulty doing work around the house because you are sleepy or tired? Okay. Do you have difficulty operating a motor vehicle for short distances, less than 100 miles, because you are sleepy or tired? Right? Do you have difficulty operating a motor vehicle for long distances because you are sleepy or tired? Okay. Do you have difficulty getting things done because you are too sleepy or tired to drive or take public transport? Okay. Do you have difficulty taking care of financial affairs and doing paperwork because you are sleepy or tired? Right. And 10. Do you have difficulty performing employed or volunteer work because you are sleepy or tired? All right. Very good. We've got one more quick page here. Bear with me. Just an overall review of your symptoms, or systems, I mean to say. Let's see. Have you experienced any significant weight changes in the past couple of years? Okay. All right. Have you had any issues with your eyes? Okay. Any issues with your ears, nose, throat, including loss of hearing, dizziness, nose bleeding, gum bleeding? Any respiratory issues like a chronic cough, bronchitis, shortness of breath, wheezing? Okay. Any cardiovascular issues? Okay. Any gastrointestinal issues? All right. Any endocrine system issues, diabetes, thyroid problems, hormone treatments? Okay. All right. Urinary systems. Okay. Skin issues, neurological issues, psychiatric issues, musculoskeletal issues. All right. Okay. Got it. Any other issues? Okay. All right. And who is your primary practitioner? All right. I think I've heard of her. Her name rings a bell. Okay. So, we've finally finished the questionnaire. I'm sorry, I know that took a little bit of time. But that's really important stuff there. I'm going to put that in the chart later. But just based off your answers, I'm really glad that you came in today, and I definitely want to try and get you access to either a take-home sleep study or an in-office sleep study. Okay, I'm gonna do a few more things here. So first I'm just gonna need you to open your mouth. I'm gonna take a look at your throat. Okay, so go ahead and open. Good. Okay, look up. Okay, can you lift your tongue for me? Okay, I'm gonna take a look in your nose. All right. Look. Okay. Very good. So you got a little bit of a narrow palate. Have you talked with your dentist about any of these issues? Okay, so they are aware. All right, that's good. All right, and I'm also going to measure your throat really fast. If you could just sit up straight for me, straight as you can. Okay. Just going to very gently come around here. Okay. All right, so not significantly big or small, I'll say average. All right, and the last thing I need to ask, what kind of insurance do you have? Okay. All right, so they typically, I typically do need to contact insurance, and I think we're gonna go ahead and do a at-home sleep study, but I am going to contact your insurance first to make sure it's all covered and taken care of, and make sure, some insurances want you to go ahead and do the in-office instead of the take-home, so I'm just going to make sure everything is covered and the insurance is on the same page, right? So I'm going to send you a message. I'll give you a call in a few days and tell you to come on back and hopefully collect your take-home sleep study. All right, and then we'll take a look and really see what's going on. Yeah, of course, sleep is important. You want to look as happy as Sammy the sleepy squirrel here does when you are in your bed, happy, relaxed, sleeping. You want to have good sleep. It's important. It really is. So until then, I know you're having difficulty with sleep, and we are going, the whole medical approach. But before, we get your sleep results back, try to stay off your phone. Try to avoid really all screens a couple hours before bed. Make your bedtime routine as consistent and relaxing as possible. You want your mind ready for sleep whenever your head hits the pillow, okay? Okay, and hopefully we'll get some really good results and we'll be able to get you the help that you need, all right? Okay, well, it was so good to meet you. Thank you so much for coming in today, and I'll either send you a message or give you a call in a couple days about your sleep study, okay? All right, I'll talk to you soon.